Best age to start strengthening your shoulders?
It is now. It is not the age, it is the timing now. Wherever you are, whatever is your age, just start with the basic exercises for the shoulder.
Shoulder pain, ice pack or hot pack?
Ice packs, definitely.
Anytime?
Most of the times.
Okay, so what are the situations where we might need a hot pack?
So I definitely ask the patient to use the sling at night for almost 3 months post surgery. But in the daytime, the patient can be off the sling and just do his basic.
Biggest mistake people make in shoulder recovery?
Too early and too heavy physiotherapy. I think that is one big mistake. Goes on commercial ships and all. So he had come on a break and he was doing his exercise on the tekdi. So Pune is very famous for these tekdis.
Achha.
So he was doing his deeps on the tekdis and he suddenly heard a snap in his shoulder. Right. So he knew there's something wrong. He went to a doctor. He gave him a sling and maybe painkillers and everything. And after a month, he was just referred to the physiotherapy. He was having tremendous pain during the physiotherapy rehab. But that still continued for a few months. And when the pain became really unbearable, almost by 6 months it had passed, he came to me.
Achha.
I checked him and I knew that there's a rotator cuff tear, a massive tear. We did his MRI, it was a massive tear. Imagine a 55-year-old healthy person who has lost 6 months in this now.
Have you ever winced while trying to put on a shirt or avoided sleeping on one side because your shoulder just won't let you? Maybe you have brushed it off as just getting older, or worse, you have been quietly living with the pain, hoping it will magically go away one day. Today, we are going to talk about rotator cuff injuries, the ones no one talks about until you can't lift your arm, hug your kids, or can't even grab something from the back of your car. From myths like you will definitely need a surgery to the surprising daily habits that could be making things worse. This episode is for every person who ever thought this shoulder pain isn't normal. Joining us today, we have Dr. Abhay Kulkarni, a highly respected orthopedic surgeon with over 25 years of medical experience, including 2 decades dedicated specifically to shoulder conditions. He currently practices at Sayadri Super Specialty Hospital, Deccan, Gymkhana, Pune, where he is known for his clinical expertise and compassionate patient care. After earning his MBBS from Bharati Vidyapeeth and MS in orthopedics from Pravara Medical College, he went on to become a member of Royal College of Surgeons in Edinburgh. We are thrilled to have him with us today to discuss rotator cuff injuries, a topic he is not only deeply passionate about but highly experienced in treating. Hello and welcome to another episode of Sayadri Health Talks. I'm Dr. Tushita and today we have with us Dr. Abhay Kulkarni.
Hi,
Hello,
Tushita.
sir. How are you?
Hi, I'm fine. Good. How are you?
I'm good. Welcome on Sayadri Health Talks.
Thanks for having me here. Thank you.
We wanted to have you here from a long time, and the topic which we picked up for today is rotator cuff injuries.
Right.
So before I dive into that topic and we talk more about it, tell us about your journey in orthopedics. How has this been so far?
So I would say it has been, God has been really very kind to me, and I have very good teachers at each part of my journey. So right from my MS ortho and then my shoulder specialization, my fellowship in Korea, I have had the best of the teachers, and I feel very lucky to be in this field.
So you have been practicing from quite a long time, and as you said that your academic background has taken you to different places.
Yeah.
So how does it feel to treat people from different culture, from different background, and then now in Pune, and considering that Pune is slowly growing into a good hub of having good medical facility. So how has this journey been?
The journey is good, but one thing common I feel is that the patients everywhere are almost the same.
Acha.
Because the gratification we get after treating a patient is same everywhere. And a well-treated patient, and shoulder, as you know, causes a lot of pain.
Yeah.
There's a lot of functional disability. And once the patient gets better after the treatment, maybe conservative or surgical, the amount of respect, honor, and the amount of love the patients give everywhere around the globe is the same. So that really keeps us going on and kicking up.
So what motivated you to take shoulder as your specialization?
Okay, so actually it was just an accident, you could call, because
A good accident, I would say.
yeah, okay, some accidents are good. So initially I was mainly doing, after my MS, I was into trauma and all. I had big plans to go abroad, but there were some issues with the European Union visa and all. So then that plan got cancelled. So plan B was no plan at all. So then I landed up with shoulder. So it was an accident, and then I fell in love with shoulder, and now it is my first love, you can call. So that's how it is.
So that's how the journey for shoulder
Yeah,
started.
started.
So coming to the today's topic, which is rotator cuff
Yeah.
injury, right? So tell us about it. What is, because for many layman people, I'll tell you why I'm asking you this question is because usually whenever it comes to a shoulder pain or shoulder injury, the first thing that comes to mind is frozen shoulder.
Yeah.
And many people get confused that ये rotator cuff injury, frozen shoulder,
right.
ये सब almost same होते हैं, which definitely नहीं होते हैं.
yeah.
So let's start with this.
Right.
What is rotator cuff injury?
So the biggest myth in shoulder, maybe it's in the society, that every shoulder pain is a frozen shoulder.
Yes.
So we have to come above that. So rotator cuff injuries is so common. If I tell you the incidence, it is 20% of the population above the age of 60. You know, that's a huge number.
Okay.
And out of that, not each and every patient will be symptomatic, but almost 30% out of those 20% of the population are symptomatic and will need some treatment at some point of the time. So here we are dealing with a big number of patients, a large number of patients. Most of the patients would get diagnosed very late, or would not get diagnosed until the pain becomes really unbearable, and sometimes the cuff becomes irreparable. We'll come to that, what is an irreparable tear. But diagnosing at the right time and knowing, understanding what is a rotator cuff and
Injury.
rotator cuff tear is very important.
So help us understand, our viewers, what is rotator cuff at the first place?
Yeah. So see, the shoulder joint is a ball and socket kind of a joint. The arm bone gives a ball on the head of it, and the shoulder blade gives a socket. So it's a ball and socket kind of a joint. Every joint needs gears. So in the body, the muscles and the tendons, the muscles get transformed into tendons, and then they act like gears. So there are 4 muscles in the inner layer of the shoulder, and these together form like 4 gears of the shoulder.
Acha.
They'll move the shoulder in different directions.
Acha.
They form like a hood, and and that's why it is called like a cuff of a of a shirt or something.
Acha.
They're attached to each other. One will take your hand out, one will take the hand up, one will take the hand behind. So all these 4 muscles together, these are called as rotator cuff.
Acha. And any injury to these muscles are eventually rotator cuff injuries.
Injury, exactly.
Okay. So coming to the first point which we said, right? How is it different from a frozen shoulder?
Yeah. So see, frozen shoulder will mainly present with stiffness
Acha.
and pain. So when the patient is unable to, take his hand behind.
Yeah, because I remember my granny had a frozen shoulder, and her problem was she was not able to lift her hand beyond this.
Yeah.
So how is it different
Yeah.
from the
So in those patients, mainly, as I told you, it is stiffness. The hand doesn't go behind. So ladies find it difficult to wear the innerwear.
Yes.
Gents cannot reach their pockets.
Yes.
So these are, but it slowly starts up. It is not like one incidence and it just starts, right? And slowly it is going to increase. But if you examine those patients, the power in the muscles is normal.
Acha.
Yeah, but whereas in a rotator cuff injury, the power, when we check the patient, when we clinically examine the patient, the strength or the power is decreased.
Acha.
So that's the main difference in both of them.
Acha. Okay.
So that is known after a clinical examination itself. Will be clear whether it's a frozen shoulder or whether it's a rotator cuff injury.
So as you said that 20% of population above 60 years of age usually face problems with rotator cuff injuries.
Right.
So, can we say that it is only specific to that particular age group, or can it be seen in any?
It can be, yeah. So it can be seen in younger patients, but those are associated with sports injuries, mainly
Acha.
weightlifting or maybe cricket injuries.
Acha.
But they are rarer in younger age group. Rotator
Acha.
cuffs are rare. In younger age group, you would have more of a shoulder dislocation or a ligament tears, right?
Okay.
And in the elder age group, as the age goes on
So,
increasing,
is it a degenerative process?
there is, I would say, degenerative plus a small tear. So mainly it is degenerative. The tears are mainly degeneratives, but there is a small incidence that occurs, and the muscle just stays off.
So, sir, as you said, right, that it is seen in 20% of people above 60 years of age. So, is there any particular age group, and can we say that it happens only in geriatric age group, or is it also seen in young people?
Yeah, it is also seen in young patients, but in the younger population, it would be associated with sports injuries, mainly gymming injuries, or in our this thing cricket injuries, right? But the incidence is very low in a younger population. Especially by 60, the incidence goes on increasing, and it increases by 70s, 80s. It really increases to quite a big extent. The cuff starts getting degenerated because of overuse,
Yeah.
and then a very small trivial fall or maybe a jerk,
Okay.
like just they fall while have a small fall on an outstretched hand. That can be an incidence, or lifting a bag, keeping a bag while traveling in the airport. I've seen while lifting the luggage. These small injuries can cause the cuff to tear.
Acha.
So that is how it happens.
Usually, in people, particularly above 60, they face some or the other form of pain here and there. So, how do they find out that this pain is just a normal shoulder pain, and this is something which needs to be taken care of?
Yeah. So I think that's a very good point. So any shoulder pain should not be taken lightly.
Acha.
So whenever there's a pain, you take some paracetamol or do some icing.
Yeah.
See for a week or 10 days. But suppose the pain is not going down, and especially if the pain is increasing at night,
Acha.
if the pain is increasing with overhead activities, and if the pain is referred to the arm.
Okay.
Most of a patient will say that your shoulder is not hurting, the arm is hurting, because it's a referred pain. The nerve of the shoulder and the arm is the same.
Is the same.
That's why the patient will come with arm pain. So if any of these things are there, it's better to see a shoulder specialist. I'm specifically saying shoulder specialist because a shoulder specialist can diagnose it almost by 90% of the times by just clinical examination.
So, coming to the diagnosis part of it, how does the diagnosis happens? I mean, is it, does it require some special form of scans, or is it a physical examination?
Yeah. So mainly it is clinical examination by the shoulder expert, the shoulder orthopedic surgeon, and that as I told you gives almost 90% of times the diagnosis would be done. But definitely it has to be substantiated by an X-ray and an MRI scan for the shoulder joint. So
Okay.
these two things have become very important in today's day of practice.
So that's about the diagnosis. Now coming to the treatment part, like any other, orthopedic condition. Not every orthopedic condition requires surgery at the first go,
Yeah.
unless it is a fracture or a trauma kind of a thing.
Right.
So does that apply same for rotator cuff injuries
Yeah,
also?
so it definitely applies to rotator cuff injuries. So once we do an MRI scan and have an examination, we find out whether it's a full thickness tear or a partial thickness tear, right? So this is two things. And how big is the tear? Is it a very small tear or is it a really big, massive tear?
Acha.
So the treatment completely differs in partial tears and in small tears. Initially, we would start with a conservative trial that would include some painkillers, some ice packs, maybe an arm porcelain at night. And once the pain goes down, then we can refer the patient for physiotherapy. But physiotherapy has to be very gentle to start with. That is very, very important, right? But on the other hand, if the tear is a full thickness tear and it's a massive tear, then definitely the patient would have to undergo for a surgical treatment.
So in the non-surgical aspect of the treatment, as you said that you give ice packs and certain kind of medication followed by physiotherapy. So how long should a person, or how long do you try it out before you opt for a surgery?
Yeah. So what I usually do is that I initially would give it for a week or 2 weeks. then check the patient and call the patient for follow-ups regularly and just see whether the pain is going down, whether the patient is improving. If the patient is improving, then we would, almost, let's say 2 to 3 months is the period that would take. But if the patient initially improves and again goes down, or if the pain increases, then probably he would go into the surgical part of the
part of
treatment.
the
then, yeah.
treatment. So why is this commonly this surgery is called as very painful?
So this is again a myth, and I want to take this opportunity to tell all the patients that shoulder surgeries post-op period are not at all painful. We have really worked well on the pain management protocols, and I can really assure you that the shoulder surgeries and the post-op protocol will be almost painless.
Acha.
So there are a few patients now asking us, doctor, have you really done our surgery? Because I didn't feel the pain at all. So I don't want to boast, but that is the level we want to take the pain management to, that level.
Okay, so take us through a day where a surgery happens and what a patient should expect during a surgical intervention.
Yeah, so the diagnosis is done. We have decided that the patient needs to undergo surgery. We take a physician fitness. The anesthetist sees the patient first. The patient gets admitted on the day of the surgery, right? The surgery usually is around 1 or 2 hours, 1.5 hours, that way, right? So post surgery, the patient will be in a sling, and we usually advise the patient to be lying in a reclining position,
Acha.
and with some shoulder support behind the shoulder.
Acha.
So that really supports the shoulder. From the next day onwards, movements of the shoulder are started.
Acha.
We start with thigh slides, just moving the shoulder, moving the arm. From the second day itself, we start that, right? And a very few exercises initially. After 1 week or so, the patient, if it is a right-handed patient, he can start eating with his right hand by 1 week itself. He can start working on a laptop by 7 days to 10 days.
Acha.
By 2 weeks, the patient should expect that he can start brushing his teeth, or maybe, just wash his this thing. Main thing is that the activities and the physiotherapy will go very slowly, step by step. There is no rush in this.
Okay.
Shoulder pain, I always say that patients with shoulder pain or shoulder patients and shoulder surgeons have to have patience.
So doctor and patients with patience.
Patience, yeah.
Okay.
And that is a golden formula for success in shoulder surgery. Mantra, yeah. That's it.
So that's about that. So when you said the recovery part is quite smooth, and I also remember while I was having a discussion with you on this topic, you said that the role of physiotherapy is very, very specific and very customized.
Exactly.
You don't rush patients post surgery to, that aggressive physiotherapy part is not done. And it is very systematic and very customized. Help us understand more of this.
So see, what we have found out through our experience in last few years, that these are senior citizens, they have undergone a surgery. There's some pain, not much pain, but functionally they're not completely, the hand is in a sling, they're not moving around. For such a patient to daily go to a physiotherapy center and come back, and again, so it becomes very difficult for them logistically, for the patient himself and for the relatives also.
Relatives and the patient family.
So,
yes.
yeah, exactly. So, to just take this out of that, we have formed a rehab program in which the patient doesn't have to go to the center for almost 2.5 months after the surgery. During this time, the patient keeps on meeting me after 2 or 3 weeks, and we give them a set of exercises.
Which they can do at home.
Very easy, yeah, which they can do at home, and with some monitoring if needed. Otherwise, the patient can do it himself or herself. And every 2 to 3 weeks, new exercises are added. They have to do the previous ones. This time is needed for the cuff, which has been repaired, to heal up.
Acha.
And then once it heals up, it's like planting a new, seeds or plant.
Correct.
So the plant has to take roots. Once it takes roots, then you can go to the physiotherapy center and then start strengthening.
Achha.
And in this physiotherapy part, when it goes
program.
to actually the department, we don't use modalities, almost we don't use any modalities because the pain part is sorted out. Patient just needs balancing and strengthening
exercises.
So those which are done at the this
So what would be that one message that you want to give out to all the patients who are recovering from rotator cuff tear?
Yeah. So again, as I told you, patience. They have to be really patient, and I usually describe the shoulder like a rebellious kid.
Acha.
You know, so if you push it hard, it is going to push back.
Acha.
But if you are very patient with it, you say, okay, do it slowly, then it will fall in line and it will give the best results possible.
Yeah. So what are the other challenges which patients face during the recovery?
Yeah, so other challenges is pain during physiotherapy or during those exercises and stiffness.
Acha.
See, whenever there is a big massive tear, then those patients are going to get stiff. But there is nothing to be worried about stiffness. Stiffness is not at all a worry because eventually it is going to settle out and the shoulder is going to open up. So I'd like to assure our patients that don't be worried about stiffness. And the pain part, as I told you, we will definitely, we have a complete cascade of pain management. So if some patients need more analgesics or treated differently, whenever they meet me on my follow-ups, I usually, will upgrade the painkillers or maybe a small tricks. As I told you, just keeping a small pillow behind the shoulder. That
supporting
itself causes,
it right.
yeah.
So that makes a lot of difference.
Yeah, we take care of the pain completely. So pain and stiffness, other than losing patience. So these three things, I think we need to take care, and we are completely aware of it. And we take effort to work on these 3 points.
So when it comes to the surgical aspect of it, what kind of surgery are we talking about? It's an open surgery or, what happens during a surgery?
So see, this surgery is an arthroscopic surgery. Arthroscopy means it's a keyhole surgery.
Acha.
So
minimally invasive again, something
minimally
like
invasive. So there will be just three or four small holes in the shoulder joint through which the whole surgery will be performed. We have special instruments, special arthroscopes, telescopes through which this surgery will be performed. The advantage being, once it is arthroscopic, it is very, very precise.
Acha.
So because we see the field like 20-30 times bigger and can precisely address the point where the problem is. And because it's a minimally invasive surgery, the post-operative pain is very less.
Acha.
So
yeah, because the tissue damage is less.
Exactly. So tissue damage is less. And open surgeries is almost now archival. So for rotator cuff.
So when was the last time you did an open surgery?
That would be almost 15-20 years back.
Oh,
and
wow.
So
from last 15-20 years, it's been only minimally invasive. Surgeries.
Yeah.
What does happen during the surgery?
Yeah. So see, the surgery actually, as I told you, the cuff tears off, and we have to. I just missed that point. So when the muscle tears off, it slowly retracts from the bone and goes behind.
Acha.
Right? And in this, why early diagnosis is important, because if the patient comes to us very, very late, and then the tendon would have really retracted and the muscle would have lost its power. So that is a time when we say that the muscle is irreparable. And then a rotator cuff repair would not be a right treatment for him.
Okay.
The patient might have to go for a reverse shoulder replacement surgery.
Acha.
He might lose his natural joint.
Acha.
Right? So that's the importance of an early diagnosis and early treatment. Where we can save the natural joint. So in these early tears, and what we do is that the tear is mobilized, the tendon is mobilized, it is brought back again to the bone, and it is sutured there with special screws.
Acha.
These are called as suture anchors.
Acha.
So they are like plastic anchors, or they are absorbable anchors. They don't have to be removed after that. Just 5mm anchors which have threads already in them. So with those threads, we suture the complete tendon back to the bone.
Acha.
The idea being, once they are sutured back to the bone, they'll start getting the nutrition and blood supply from the bone,
Acha.
and their roots will go in and give a good anchorage onto the bone. And that's the surgery. So, and it's a very, very successful surgery. So I'd like to quote that it is, now we are quoting a success rate of almost 95 to 98%.
So one of the safest surgeries with good outcomes.
Good outcome, yeah. And it is actually life changing for these senior citizens, because for a senior citizen to get dependent on someone and not able to do his own work is really, really bad for him. And it takes a hit on his own self-respect, and the pain and suffering is different. So it is very critical, it is very crucial that we diagnose them at the right time and give them the right treatment.
Okay, so moving on to the next segment of this podcast, which is I will read out a few lines for you,
Right.
which might be a myth or a fact. If it is a myth, you will have to give us an explanation,
Right.
and maybe a one-liner or one-word answers, a few of them.
Sure.
Yeah. So, what's the most common symptom of a rotator cuff tear?
So it is pain in the shoulder, pain at the arms, and pain which increases at night,
Okay.
and especially on overhead activities.
Okay.
So these 3-4 points are, patients come to us with these 3-4 points.
Surgery or physiotherapy? What's your gut choice?
Depends upon, as I told you, depends upon the
Is
size of the tear.
is it wrong to ask this to a surgeon?
No, of course not. Because see, a patient treated surgically or non-surgically is a successful patient after all. What is important is that patient gets relieved of his symptoms and it becomes good. So most of my patients whom I have treated conservatively have referred me a lot of patients,
अच्छा.
surgical patients.
ये
So
doctor
all
surgery
patients
नहीं
are good
करते
for us.
तो ये डॉक्टर सर्जरी नहीं करते, ये ऐसी दवाई दे के ठीक कर देते.
So
Okay.
patients are patients. Right?
Patients
So,
are patients, right? Best age to start strengthening your shoulders. Actually, I wanted to ask.
Yeah,
this.
so it is now. It is not the age, it is the timing now. Wherever
Achha.
you are, whatever is your age, just start with the basic exercises for the shoulder. What is important in shoulder is, bracing up. A good posture is very important. So posture correction and, working on the balancing, we call it proprioception in our terms, and strength training. So anyone can start it at any age, but just one has to start as early as possible.
Shoulder pain, ice pack or hot pack?
Ice packs, definitely.
Anytime?
Most of the times.
Okay, so what are the situations where we might need a hot pack?
I almost never use a ice pack. See, there is no contraindication for a
So you mean to say you never use a hot pack?
hot pack. Sorry, I never use a hot pack. So the ice packs, there is no contraindication to an ice pack. So only would be when a patient is sensitive to cold and all and doesn't tolerate that. So very, very rarely, but not at all in the immediate post-op period. Never. In chronic cases, yes, I do use the hot packs in between, and especially for the neck pain. Sometimes neck pain and shoulder pain come hand together because the muscle groups are almost similar. So many patients will complain of neck pain or trapezius pain.
Yeah.
So those can do good with hot packs.
Achha.
But ice packs is my treatment of choice.
Go-to
Go-to,
treatment
yeah.
of choice. So when it comes to strength training,
Yeah.
dumbbells or resistance band?
So it has to be dumbbells first and then followed by the resistance band.
Acha. Okay. So morning or evening workouts?
Okay, it actually doesn't matter. So workout has to be done. So whichever time
कर लो,
you do
कभी भी
it,
तो कर लो.
कभी तो कर लो, yeah.
कभी तो कर
So
लो.
mornings would be, I would prefer mornings, but anytime.
Okay. Okay. Biggest mistake people make in shoulder recovery?
Yeah, so rushing for too early and too heavy physiotherapy, I think that is one big mistake they do, and then getting panic with pain or stiffness. So these two are the biggest mistakes.
Okay. Should you keep moving or rest after a minor shoulder injury?
The patient can be, he could be moving mobile, but with a sling in his hand. So we usually advise the sling to be worn whenever the patient is traveling, and especially at night. So I definitely ask the patient to use the sling at night for almost 3 months post surgery. But in the daytime, the patient can be off the sling and just do his basic activities like working on a laptop. Ladies can do some minor work in the kitchen and all. So those are allowed.
Okay. So what will be the biggest myth that you have heard from your patients about shoulder injuries?
So is that we have heard that it is very painful and it never gets good, better. The shoulder never gets better. So that's the biggest myth I've heard from the patient.
Achha.
So here we are doing exactly the opposite.
Achha.
So we are almost, as I told you, giving painless surgeries and with a very, very consistent and a very good success rate.
Great. So before we let you go and end today's podcast, we have a section which is called as storytelling.
Okay.
So you have to tell us some story of a case which was really challenging
Right,
for you.
right.
and which you have done and has come out with beautiful results.
Right. Yeah, so there are quite a few, but the one I starkly remember is a patient of mine. I would not give his name. So he was a sailor. He's a sailor. He's still a sailor. Goes on commercial ships and all. So he had come on a break and he was doing his exercise on the tekadi. So Pune is very famous for these tekadis.
Acha.
So he was doing his deeps on the tekadis and he suddenly heard a snap in his shoulder. Right. So he knew there's something wrong. He went to a doctor. The doctor just, I don't know which doctor he went to, but he gave him a sling and maybe painkillers and everything. And after a month, he was just referred to the physiotherapy. He was having tremendous pain during the physiotherapy rehab, but that still continued for a few months. And when the pain became really unbearable, almost by 6 months it had passed, he came to me.
Acha.
I checked him and I knew that there's a rotator cuff tear, a massive tear. We did his MRI, it was a massive tear. Imagine a 55-year-old healthy person who has lost 6 months in this now. The tear was retracted to quite some extent.
Acha.
But because he was 55, 60, around that age, we planned to do he was just on that irreparable on that borderline.
Just at the edge.
Just at the edge. But we took the risk and then we went ahead, we did this repair, we could repair it. Another issue happened because for 6 months he was not really using his shoulder. The bones had become very soft.
Acha.
So these were the two main challenges. But we used, as we use very good kind of anchors, and after the surgery, we put him on a lot of calcium treatment and other treatment
Supplements
and he really did well. So he is completely healed up on that side. A few years down the line, he had another injury on his ship. This shoulder didn't tear. The other shoulder had a rotator cuff tear.
And this time he came on time.
He came on time and then he got treated early.
So the lesson learned right.
Lesson learned right.
Correct.
And the shoulder which we had operated didn't tear up. So that was another, point of success. So
Yes.
I think missing a diagnosis is very bad.
Very bad.
Right. So, and I think giving patient good treatment in good time is not just a duty, but I think it's also social service because I've seen many patients suffer because of this shoulder pain. That's why it is really passionate for me. Even frozen shoulder for that point. I take almost 10-20 minutes to explain the patient everything regarding frozen shoulder. I think we should have a podcast on that also
Definitely.
one day. Yeah.
Coming up with
Yeah.
that. So what would be the final ending message for all our viewers from Dr. Abhay Kulkarni today?
Yeah, so the message would be don't worry about shoulder pain. The crux is to go to a shoulder specialist as early as possible, get yourself diagnosed, and don't worry about pain. The success rate is very high, and probably listen to what your doctor is telling you.
On that note, thank you so much for joining us today on Sahyadri Health Talks, and we had a lovely discussion on rotator cuff injuries. Looking forward to have you again on this podcast, as you already committed that we should do one on frozen shoulder. We will be soon, having you back on this couch.
Tushita, thanks a lot. It has been wonderful speaking to you, and thank you really. I feel lucky and honored to be here with you. Speaking
Thank
on
you so much.
my favorite topic, that is shoulder.
Thank you so much.
Thank you very much.
On that note, signing off, Dr. Tushita, Sahyadri Health Talks.